Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good evening, viewers. You're welcome to the DOCtalk show. Today before you is a team from Mulago Hospital ready to delve into endocrine surgery. I would like us to introduce ourselves, starting with our boss on the far left.
Okay, thank you. Good evening, viewers. I'm Dr. Kintu Luwaga. I'm a consultant surgeon from the Breast and Endocrine Surgery Unit of Mulago National Referral Hospital.
Good evening, viewers. I'm Dr. Innocent Olimunsi, General Surgeon in the Breast and Endocrine Unit, Mulago National Referral Hospital.
And myself, your host for today, I'm Arach Patricia. I'm a surgeon on the Breast and Endocrine Unit. We are here before you to delve into the topic of endocrine surgery, to try and understand what it is, what these diseases are. So, team, could we look at more what endocrine surgery entails and what different disorders there are?
Okay, so endocrine surgery is a branch of surgery or subspecialty that mainly looks at diseases involving the three glands in the body, one being the thyroid gland, the second being the parathyroid gland, the third is the adrenal gland. So disorders, diseases that involve these particular glands, they fall in the realm of the endocrine surgeon.
Okay, well said. The thyroid gland, where is it? What does it do? What does it help in the human body? And what shows when it has gone wrong, when things have gone wrong?
The thyroid gland is a gland of about 20 grams located in our necks, and under normal circumstances this gland produces hormones or chemicals that help our bodies to function optimally in terms of the work we do, in terms of activity, the various activities in the body, including our sense of understanding, the way our muscles work, and all the parts of the body basically are supported by the chemicals or the hormones from this gland. Now, this gland can have disorders, both in the structural sense and also in terms of functionality. So in terms of structural disorders, this gland can enlarge, and as it continues to enlarge, it will interfere with the other structures in the neck where it sits. Commonly, it will compress the airway. It will also compress the passage of food in the neck. It will also compress other structures that sit in the neck, like the blood vessels. And when this happens, the patient progressively becomes uncomfortable with difficulty in breathing, difficulty in swallowing, and generally their life becomes unbearable. On the other side, if it's disturbed in terms of functionality, it may produce these hormones we've talked about in excess. And when this happens, you'll find that the body functions that would otherwise be going on normally are now disrupted. And for example, if impact is felt right from head to toe, patients with an excess production of hormones from this gland, when it comes to their mood, it is disturbed, they are restless. When it comes to their bodies, they may lose weight. When it comes to their eyes may bulge out, and you may find that most of the time they're feeling hot, while others may not be feeling hot at that time. So basically we see the changes that are happening in the bodies, basically involving the whole of the bodies, because these hormones run throughout our bloodstreams. And when they're in excess, we see changes or disturbances happening in almost all parts of the body. I've mentioned a few, but basically those are some of the main disturbances that the patient will present with.
Yes, in addition to that, at times the gland may instead produce less than what is required, which in this instance we call hypothyroidism. So if these hormones are not being produced in the quantities that the body needs, again that becomes a problem. And as a result, we can still have enlargement of the gland, which we call goiter, but also a patient will have certain signs and symptoms. So the body generally slows down, as opposed to when it is overproducing, where the body becomes overactive. In this case, the body slows down, so you have reduced heart rate, you have the patient feeling cold, especially in the evening hours, you have constipation, you might have enlargement in the lower parts of the body, which we call edema. So all these come in when the gland is producing less than what the body requires.
And maybe just to add, some of these things may start with the thyroid gland, but may go on to affect the other systems of the body. Like Dr. Kintu mentioned, you might actually have a high heart rate, the feeling that your heart is beating very fast, and your blood pressures may rise high, and it might instead affect another system in which your heart is. So the effects can be far-reaching if they are not curbed in time. Are there ways that these symptoms and these diseases can be curbed?
Yes. So one of in the production of hormones by this thyroid gland, one of the important ingredients is what we call iodine. And nowadays, the iodine insufficiency is not so pronounced because of the table salt that I believe is present in virtually all our homes. That table salt now is iodized. It has that bit of iodine. But again, you find that maybe people who are not, again, even having this salt in quantities that are enough, and also the other food sources that might be having iodine, like cabbages, like eggs, chicken. If we are not taking in enough, we might end up with inadequate iodine stores in our bodies, which then result in the insufficient production of these hormones. So in other words, one of the ways that actually some of these diseases of the thyroid gland can be prevented is by making sure that we take in enough of this iodine.
Very well. Thank you for that.
Okay. Talking about prevention and control, we said that these disorders of the thyroid gland may be structural or may be functional. Now, what my colleague Dr. Innocent has talked about is basically in relation to what we commonly know as goiter, which is commonly related to inadequate iodine in our diet in terms of its origin. But we also have other conditions which may lead to disorders in the structure or the function of the thyroid gland. For example, there is a disease that is called Graves' disease, named after this physician who first identified it and described it years ago in Europe. Graves' disease is an autoimmune disorder So unfortunately for this condition, you may not do much to prevent it, but when it begins to manifest, especially through excess production of these hormones, then these patients will present with the signs and symptoms we've talked about. And I think what is important in such circumstances is to present early to the relevant medical teams who would do additional assessment to diagnose it and then support the patient in terms of treatment. The treatment may be medical or surgical, and that's where we come in.
Okay, very well. So that was it with the thyroid gland. Like many other structures in the body, it could also get malignancy, so it can also get cancer, like other parts of the body. And this cancer has different types of cause. One thing we didn't mention is that most thyroid disease is common in women. But then if a man has a thyroid growth, they should possibly run to the hospital faster than the women because their chance of it actually being a malignancy is much higher. So we have to be really vigilant about this. We shall be back with more endocrine disorders after a break. Thank you.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
On Wednesday, the 1st of May 2024, Uganda will join the rest of the world to commemorate the International Labour Day, a day celebrated to recognize the contribution of labour towards the social, economic and political development of the country. This year's celebrations will be held at Mukabura grounds in Fort Portal City on the theme, Improving Access to Labour Justice, a prerequisite for increased productivity. The celebrations will be cast live on UBC TV, all our radio stations and social media platforms. Don't miss. Happy Labour Day.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back to the show. So the thyroid gland locally here in Buganda is known as DOCtalk. The DOCtalk usually refers to the Adam's apple, but also refers to the gland, and even the nomenclature in English is similar to that. So these diseases, Mr. Kintu, as we see patients every day, how often do we find the patients that have thyroid disorders?
Okay, thank you. So thyroid disorders are quite common the world over, but goiter in particular is really ranking very high among the thyroid disorders, both on the global scale and also in Africa and Uganda in particular. And it's more common in areas which are on the foot of highlands because of depletion of soils of iodine, which is a key ingredient in the formation of the thyroid hormones by this gland. In Uganda in particular, in Mulago Hospital, we see over 1,500 endocrine cases in the endocrine surgery unit, which runs every Wednesday, and about 90% of these are actually goiters. So this goes to show you how prevalent this problem is in our setting. And we also see most of them presenting with complications, like difficulty in breathing and also congestion of the blood vessels and other structures in the neck. Yes.
Let's move on to another gland. Endocrine is to do with glands, and glands secrete substances like hormones. So the other gland is the adrenal gland. It's found just above your kidneys. I believe most of us know where the kidneys are. So it's also popularly known as your suprarenal gland. As small as it is, it can have far-reaching effects Dr. Olimunsi, would you want to take us through some of the conditions of the adrenal gland?
Yes, thank you. So this adrenal gland, as Dr. Arach has highlighted, it is structurally, it is divided into two parts. It has the outer part, which we call the cortex, and it has the inner part, which we call the medulla. Now, the outer part, the cortex, secretes hormones. As we already said, these are endocrine glands. Importantly, two hormones, one called cortisol, okay, and then another one called aldosterone. Now, this cortisol the body needs it. It's what we call a stress hormone, but it is also required in performing many other functions, importantly regulation of blood sugar in the body. So that is why in the instance where it is being over-secreted, we have complications arising, and one of them includes diabetes mellitus. So not everyone out there who has diabetes is because of a problem with another gland called the pancreas. Sometimes you might find that the problem is actually arising from this adrenal gland. And also other complications like high blood pressures. You find basically the body outside, certain changes happen in terms of the way the face looks like. There's that rounding moon face appearance. You have deposition of fat here in the back. You have a patient that has an enlarged abdomen or lower limb swelling. So all these features, which in the medical term we call the Cushing's syndrome, are basically as a result of issues to do with the adrenal cortex.
The adrenal gland is responsible for producing a number of hormones, or in simple terms, chemicals that have different roles they play in the body. Now, the inner part talked about sometimes produces chemicals like adrenaline. And now when it is diseased, some of these are produced in excess. And one of the conditions that we know where there is excessive production of this chemical adrenaline and a related one called noradrenaline is called the pheochromocytoma. Now, these chemicals or hormones are required under normal circumstances for the body to respond in a timely fashion to various challenges or undertakings that may be required. But this time round, when they're in excess, the body is in a hyperactive state because of these excess hormones. And some of the signs and symptoms that the patients will present with will include headaches, sweating too much at all the time. They may also present with high blood pressures. And also eventually they lose weight. And many times, most of these conditions are not going away with ordinary treatment. So these patients suffer for long periods, and they usually go from practitioner to practitioner until maybe at one point relevant tests are done which identify that these particular chemicals are increased and there's a problem with this gland. And that's when will be referred to us.
But why should people be really worried about pheochromocytoma?
Okay, thank you once again. Unfortunately, in our local languages, we haven't found a fitting name yet for this condition, but we know that the set of signs and symptoms at least can be well identified by people out there. And when they do this, then they should suspect that they have a problem with their adrenal glands and report to the medical workers. Now, to answer your question directly, unfortunately, for those who delay to get intervention or who don't have a chance of early identification of this problem, they will get complications in the various parts of their bodies. These high pressures will damage the eyes, they will damage the kidneys, and they'll also damage the heart. So unfortunately, some of these patients present to us with complications. Yes, and this is one of the reasons why we should really be concerned about identifying it early and seeking early intervention from the medical workers.
Yes, and in addition, as they say that every cloud has a silver lining, the thing about this secondary hypertension is that if it has been detected and we find that the cause is a pheochromocytoma, when the patient gets this surgical intervention that Dr. Kintu has talked about, then the pressures actually normalize eventually after undergoing surgery. And therefore, the patient has a chance of going off the medications for high blood pressure, as opposed to the other primary hypertension, which is common. And for it, the patients usually have to remain on medication almost for the rest of their life.
Thank you very much for those very detailed submissions. So back to the adrenal cortex, Dr. Olimunsi talked about Cushing's syndrome, and there is a very related way that usually the public brings about this. Usually there is intake of the steroids, the DEXA. I have a small cough. Go and give me 1 dexamethasone or 2 dexamethasone. Before you know it, you've taken dexamethasone frequently and for a long time. This steroid, because it is a steroid in a medicine, resembles what the adrenal cortex produces in cortisol. And so intake of these medications like prednisolone, dexamethasone over a long time can bring about a picture like someone that has Cushing's disease. So we should be keen on what medicines we should take and take practitioner prescribed medications. Let us take a short break and we shall be back with anything that we haven't yet finished on the adrenal gland. Thank you.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
We've hit refresh with Castle Light. A premium new look. With the shiny silver label. An innovative cold indicator. A premium green neck label for a crisp and easy drinking beer. Fresh new look. Experience the fresh Newcastle Light.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back to the show. We are here, a team of doctors from Mulago National Referral Hospital, talking about endocrine disorders and endocrine surgery. We've looked at the thyroid gland. We have been covering the adrenal gland. And while on the break, we discovered that there is another way people actually take steroids that they do not actually are aware of. Mr. Kintu, would you like to enlighten us more?
Yes, thank you. So, talking about these steroids, my colleagues have already highlighted that some are produced in our bodies by this gland for very meaningful purposes, but we should also know that some of the medicines we take contain steroids, as well as some of the cosmetics. Now, the cosmetics that contain these steroids are usually used for bleaching purposes, for those who want to get lighter. And of course, as I try to achieve this, they end up allowing these steroids to gradually penetrate and accumulate in their bodies. So whereas you may achieve the skin lightening that you're interested in, you end up with very high doses of these steroids, exogenous steroids into your body, and then they would give you the disorders or signs and symptoms that are similar to what somebody with excess steroid presents with, what we call Cushing's syndrome. And this is equally detrimental. So this is mainly involving the ladies out there, the young ladies especially, who are very interested in unselective use of cosmetics. So we need to take care of this.
Thank you very much, Dr. Kintu. As we wind up with the adrenal gland, just as you say in the thyroid gland, it could also be having a cancer, a growth that extends even beyond its boundaries and needs intervention that is even more than just surgery, maybe chemotherapy, radiotherapy, etc. And because this growth will produce hormones like cortisol, because it's from the cortex, so the patients will actually present, as we saw with the Cushingoid patient or the patient with Cushing's disease. And so when someone has a mass, they should not sit with it thinking that it's a mass that can be taken out anytime. Sometimes the growth is more aggressive and needs to be detected early. Let us move on to the parathyroid glands, are very closely related to the thyroid, as their name suggests, para, near, thyroid. Mr. Kintu, may you involve us more about these glands?
Yes, thank you. This parathyroid gland, commonly every human being has 4 of them, and so do most mammals. But they are also located in the neck and usually seated behind the thyroid gland. So usually have 4 of them, but they can also develop disorders. These disorders again may be structural or functional, and most of the time these two go hand in hand. You have a combination. And talking about the structural disorders, they may develop changes where they swell. Okay, in the medical language, we can talk of parathyroid adenomas or parathyroid hyperplasia. And in this case, this gland is swelling, and as it swells, it produces excess hormones. Under normal circumstances, it should produce a hormone or a chemical called parathyroid hormone, which is very important in our bodies for regulating a mineral called calcium. Calcium is very important for the function of our muscles, including the heart muscles, and also for the function of our bones and the whole body generally. So when this gland develops these disorders of excess production, then we find that we have excess calcium in our bodies, and this regulation is generally disorganized, such that you have excess levels, for example, in circulation, while instead you may have reducing levels in other key areas like the bones. And this brings about a situation where the patient suffers from weaknesses in their bodies, weaknesses in their bones, which may even lead to them to fracture easily, as well as pain and other there's a whole set of changes that happen in the body. So in the same way, when we see patients with some of these symptoms, we should endeavor to forward them quickly to specialists who manage these endocrine disorders.
Dr. Newton, do you want to add on?
Yes. Yes, thank you. So again, commonly it's overproduction of the hormone, as Dr. Kintu has elaborated. And when you have this, and then it means you will have too much calcium, the mineral, in blood. And one of, again, the complications that can rise from that high calcium levels within the system is formation of stones, kidney stones. They can form in the kidneys, they can move downwards in the small tubes where urine passes to get out. And these stones can at times obstruct those small tubes called ureters. And that becomes a very painful condition and actually becomes a medical or a surgical emergency. But all that will be coming from primarily a problem with the parathyroid gland. Thank you.
Thank you very much. And yet again, like we have seen in all the glands above, these glands can have a growth. In the medical language, we call it benign, to mean that it has not big consequence, as the word suggests. Or on the other hand, fairly innocent, yes. It has grown, it has enlarged, but there is nothing much to it. The problem is you can never know if it's innocent or not so innocent, which we call malignant. So they can also develop cancers. So my question is, these symptoms are quite vague. Yeah. They don't come and say, I am parathyroid that has enlarged. And the glands are quite small, 4 of them behind your thyroid. What advice in that line do we have for the practitioners out there and also for the patients? Because for someone to ask a calcium level or a parathyroid hormone level may not be an everyday occurrence. Yes. What advice, how can we help them to going forward?
Okay.
Yes.
Yes, this particular discussion, I believe it's not just for the public,
yes,
but also for our colleagues in the various cadres of the medical practice. And it also happens that some of the patients with these conditions may meet the various lower cadres first before they can get to us. So I want to appeal to our colleagues and the various frontline medical workers to have a high index of suspicion for this condition. Unfortunately, much as this gland may have structural changes, its swelling may not be so pronounced like you would have with a thyroid gland.
Yeah.
And instead, the other symptoms may be more pronounced. For example, the bone pains, patients who are, or people who are fracturing very easily. After a simple fall, somebody is fracturing very easily. Those who are having pain in the abdomen, which may be related to these stones moving down the urinary tract, the passage of urine. So they need to be able to identify these patients early and forward them quickly. Because again, we know that you can have complications of late treatment. For example, you can have kidney failure. Yes, as these stones and other complications accumulate.
Okay, thank you so much. Let us go in for a quick break. Then we shall come back to round up the management of the patient.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Fred!
Osmosis.
Freddy! Fred Dollar, my boss, CEO Inojo, the general of generals, the conqueror of conquerors, the first and the final, the sky above the skies, the promised land, the terms and the conditions, the international king crocodile, the source of the
Osmosis.
the Nile.
I don't have money today.
Just take a polite loan of 200K to stock my shop. the signs and symptoms of success. The bank commander, not the bank teller.
Why hustle for a loan when you've got MTN Momo? We're sorting. Use the Momo app or dial *165*5# for all quick loans. Choose from the different loan options from our partners and get one that works for you. Together, we're unstoppable.
You are watching the DOCtalk Show. This message is from the Ministry of Health with support from partners.
You're welcome back to the DOCtalk Show. We do hope that these discussions are enlightening to you. So we wanted to delve into management of these patients. When they come to us with these different conditions, how do we handle them? We are a team from the surgical side, but we also have to armor ourselves with knowledge that is not particularly cutting, or particularly the knife for that matter. So Mr. Kintu, when a thyroid patient comes to us, in its broad, because some of them are physiological, some of them are functional, the same thing, and others it's just an enlargement. How do we approach them?
Okay, thank you. So the approach in the care of these patients is that indeed, like you've highlighted, they require a multi-pronged approach or a multidisciplinary team. We have medical workers who are involved in assisting with diagnosis, and that may require laboratory tests or imaging tests, where we do the scans, where we do the x-rays. And then the key person, who is the endocrine surgeon, will coordinate this and should be able to make a diagnosis and know whether the problem is structural or functional or both. And then he will plan to offer surgical intervention. But even before this, there may be required medical interventions, which we may undertake or may request colleagues in the medical endocrinology to handle. This is usually relevant to stabilize the patient, especially in cases where the functional disturbance is such that the hormones or those chemicals are too high or too low. And after stabilizing the patient and they are stable enough to have surgery, then corrective surgery can be undertaken. Most of the time with an aim of removing this grossly enlarged gland and therefore relieving the other structures of the compressive symptoms. Management thereafter would continue in a way of supporting the patient recover from the surgery and also to support their body's function thereafter, many times with supplementary medical treatment.
Okay. Dr. Olimunsi, the adrenal gland and its disorders, broadly speaking, how are they managed?
Yes, thank you. So again, broadly speaking, when these patients come to us in the hospital, the surgeons see them first, of course taking more history, examining them, but in addition to that, laboratory workup, as Dr. Kintu has already highlighted, and then again they might require some imaging, particularly high-level imaging like CT scan. In this case, it's the one we use mostly when we are dealing with adrenal gland disorders. And then once the diagnosis has been made, treatment is then commenced, and usually it may start with a medical treatment. For instance, patients with pheochromocytoma, this swelling that we talked about in the inner part of the adrenal gland, they come with very high blood pressures. And so they need a period of stabilization of these blood pressures. So we use different medicines to make sure that the blood pressures are well controlled. And once they are well controlled, then we can take them in for the operation, which usually becomes corrective.
Okay. Are all these conditions then curable by surgery or not? As surgeons, if someone has thyroid disease and they have Graves' disease and they perform a surgery, do we then offer them cure? Do their symptoms then resolve, so to speak, or not? Yes, Mr. Kintu.
Okay, thank you. Yes, like I said, many times the intervention is multidisciplinary, but surgery has a very important part to play, especially to offer definitive cure or treatment to these conditions, especially where they are structural disorders. But also we know that even in those conditions which may be having purely functional disturbances, sometimes there are limits to how long or how much medication you can use. Okay? And ultimately, surgery would come in to offer the definitive treatment. However, I also need to add that many times when you've offered the surgery, especially for conditions like total thyroidectomies and so on, you find that patient still needs those hormones to survive.
Yes.
And then they still need to go on with the medical supplementation. Yes.
So yes, also importantly, Dr. Chin said that sometimes the medical treatment may be able to stabilize these patients, but sometimes it may fail, in which case the surgical team may be onboarded in this management. Then for the conditions like the cancer, surgery as curative is one of those questions that is not definite. It will depend on how early you have come to the hospital, which will determine how early your tumor is. If it has grown beyond the margins where surgery is curative, we shall need treatment that tries to minimize it before the surgical team can come in. So surgery may cure some conditions, may not cure others. And also in the Graves patient, if there are symptoms like the popping out of their eyes, there are grades where even removal of the problem may not take back some of the signs and symptoms that the patient has. And so it's important that this patient actually comes early before the condition progresses even further. How about locally? Are there any medications these patients are taking that they should not be taking for these drugs? Any other therapies that may not be streamlined therapies, which maybe they should get off, or any beliefs that may be propagating these conditions? Dr. Olimunsi.
Yes, so one of the things we talked about was the use of steroids, which are readily available over the counter in most of the drug shops, and people use them for different reasons. But the take-home message should be that those drugs should only be used when they have been prescribed. Drugs like dexamethasone, prednisolone, and there's usually, if they are prescribed, there is a way that these effects can be mitigated, what we call tapering doses, especially for those who have to take them for over 5 days, over a week, for a prolonged duration. So this is something that we can actually work on, and in doing that we'll be preventing the bad outcomes.
Okay. So maybe we could take some parting shots and some take-home messages broadly. Mr. Kintu.
Yes, thank you. I'm thinking this very strong message you want to send out to the public is not to be in a hurry to misconceive or misunderstand some of these diseases. Some of them present in a very unusual and very scary manner. For example, you talked about Graves' disease, where the eyes become more prominent, they're almost protruding, somebody has lost weight, somebody is feeling a lot of heat, somebody is losing part of their hair, and then society is quick to relate this to witchcraft.
Yes.
And many of these patients will spend a lot of time and money seeking unconventional treatment out there with the witch doctors and others, and they can only get worse. And in fact, many times when they realize that this unconventional treatment has failed, when they get worse, it's kind of late and they have a lot of complications. The same applies to these very large neck masses. The message is this is not witchcraft. These are known medical disorders which can be managed by competent medical teams.
Okay, thank you very much. Dr. Olimunsi, any parting shots?
Yes, thank you. The message is that early identification of these diseases and appropriate care would provide us the best chance and the best outcome, even when it's about cancer. If you present early and is diagnosed early, you find that you have the best chance of getting a complete cure. So my message is that if you notice anything abnormal, a swelling, any symptoms, present early to the health facility so that the disease is identified and dealt with as early as possible.
Okay. Yes, Mr. Kintu?
Yes, I just want to note to also inform the public that Mulago National Referral Hospitals is one of the very few centers in the country with a standalone endocrine surgery unit, which has built the capacity together with auxiliary departments to make accurate diagnosis of these conditions and offer effective treatment. So I think it's important we also go ahead to inform the public of our exact physical location. Presently, in Mulago Hospital, the endocrine surgery unit is found on level 3, block B. That's where the wards are situated. However, every Wednesday, the whole day is dedicated to seeing these endocrine patients with endocrine disorders at the surgical outpatients department, which is found on level 4, block G of Mulago National Referral Hospital. So again, to our colleagues out there, the frontline health workers, they should get to know this information and refer the patients to us accordingly within that schedule. Yes.
Okay. Thank you very much for being with us on this show. We hope these conversations have started and they can keep going on. And we hope to also influence the practice of these disorders. We do hope that you had a good time with us learning, and in case of any consultations, you can reach us in the hospital and for further consultations with the team that has helped us broadcast. We want to thank UBC for giving us this opportunity, and Mulago National Referral Hospital for allowing us to practice as we do. Thank you very much.
The DOCtalk Show. This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda. This weekend on UBC.
Let's talk about love tonight. It's not going to be anything else. We're going to be talking about love. Okay? Foreigner dated justice and said, gotta take a little time to think things over. Gotta read between the lines in case I need it when I'm older. Huh? In case I